Doctor, you were discussing mastoiditis? Yes, I was. That was a part of my medical report. What are the sequelae? Well, there is a chronic discharge, or otorrhea, in a number of patients, and it may remain for months or even years and be a source of danger to the patient unless care in its treatment is exercised. What is the duration, doctor? In uncomplicated cases, the symptoms are relieved as soon as the pus is discharged, either spontaneously or by operation. Doctor, may disability follow? Yes, disability following operation to free the pus may be estimated at from 2 to 4 weeks. What about suppuration otitis media? Well, that is chronic. It is extremely likely to follow the acne form or acute form and is associated with a chronic discharge from the ear, slight deafness, noises in the ear, and possibly with vertigo. Doctor, is there any disability involved? There is little disability or danger in this condition so long as the discharge comes away freely, but if this is stopped and accumulates in the middle ear, serious complications may result, similar to those met with in the acute condition. And what is the sequelae of this condition? The sequelae is a complication of acute suppurative otitis media. Doctor, you mentioned mastoiditis before? That is correct. It is an inflammation of the bone of the mastoid process. Is this a process of bone extending from the skull downwards, doctor? Yes, behind the ear. Doctor, does it contain large air spaces? Yes, it does. And do they communicate with the middle ear? Yes, they do. Suppuration is therefore extremely likely to spread from the middle ear to the mastoid cells, and this is the common cause of mastoiditis. What is the symptomatology, doctor? Well, those of acute otitis media, and in addition pain, tenderness, and swelling behind the ear over the mastoid process. The temperature is usually very much raised with a rapid pulse. Doctor, those are the sequelae and complications? Only for acute otitis media. And what is the duration? It is an operation which is performed and the disease spreads through the bones of the base of the skull, and death is caused by septicemia, meningitis, or cerebral abscess or thrombosis. And after operation, doctor, is there any disability? Well, after operation, disability lasts for 4 to 6 weeks. Is it a chronic condition? Yes. May it follow the operation? Yes, if it is performed in the acute stage and is characterized by persistent discharge from the ear with possibly headache and vertigo. Doctor, what about syncope? Yes, syncope also. In such cases, a more extensive operation on the bone may be performed, and disability from this may last for several weeks. Doctor, what is the disease of the middle ear, or internal ear rather? It is little known, but there are diseases of the internal ear. Disturbances of the functions of the internal ear are not uncommon, and there is some evidence to show that such disturbances are associated with and due to inflammatory conditions of the internal ear or to alterations in its blood supply. Doctor, does the symptom commonly attributed to internal ear disease, is that known as nerve deafness, i.e. a deafness due to abnormality of the nerve endings of the auditory nerve? Is that in the internal ear, doctor? Yes, in the internal ear. These can be detected by an oral surgeon and can be differentiated from those cases of deafness due to middle or external ear trouble. Doctor, another common symptom is vertigo. Yes, this is due to interference with the semicircular canals in the labyrinth. Should I go faster?